Thank you.
Green things there.
These are made by our teenager stress labs that the city has held.
Not sure where the hell I got pink. Okay. So as a presentation, sir, you have supposedly unlimited time, but I'm probably going to say something after 15 minutes, so
Okay,
please
well,
continue.
thank you, sir. And as said, we're going to call this episode 2 because I was here in front of you in City Council in almost 4 years to the month, actually. And so as said, I want my colleague, Dr. Bell, to come up at the end to talk about the Nanaimo GP Specialist Think Tank. So if I am ending early, I'm hopeful for a callback, because I do want to share some information about community health, what's happened in the last 4 years. I'll tell you about who I am, our community health challenges, and then some community solutions. So there's City Council, different. I think only Councilman Thorpe is the only one that was there from 4 years ago. I don't know if you remember my presentation.
Yes, I do.
There will be a quiz and test at the end of all this. But just to disclose who I am and what I'm about and who I'm sort of representing and then not representing. I'm a fee-for-service family physician, 26 years in Nanaimo. Blue Sky Clinic co-creator, we'll talk more about that. I'm a UBC family practice preceptor teaching behavioral psychology. I'm the medical director of community health with Island Health. I'm a Nanaimo division family practice, GP lead in wound care and a member. And last but not least, a member of the Nanaimo Community GP Specialist Think Tank. So with all those titles, I feel like a race car with all those logos on me. I'm going to try and kind of keep it simple and not actually represent anyone except me, a family physician that's been here for 26 years. I graduated from medical school and then did my residency, and I've been in Nanaimo my entire career. So I care about this town, and I've seen some changes that I want to share with you tonight about healthcare. So just as a little bit of a metaphorical reference there, you can see the Greek on the door and family doctor. Bureaucracy and politics is still very Greek to me, so bear with me. I know I'm a family doctor. To sum up my talk from 4 years ago would be in these 11 words. Food is medicine, exercise is medicine, smoking is not, it will even go smoking and vaping is not, from what we've learned, and relationships heal. And those were in the 5 E's, and you can go back to the talk, it's still online to sort of see, and I'll reference back to it as we talk tonight. But if you can bring these 11 words into healthcare, some of the complicated issues that we have are simply fixed with Healing Nanaimo. It's my business to heal. So starting off, I mean, we have, you're going to hear in a couple minutes about anxiety and depression, mental health issues. We have a mental health crisis in Nanaimo, the opioid crisis, which I know you're going to hear about. But I want to share with you tonight about something that we use. It's a psychotherapeutic tool called cognitive behavioral therapy, or CBT. And I'm just curious by council, who knows about it and its therapeutic benefits? That's awesome. So we're going to actually do some CBT, if that's okay. And one of the tenets of CBT is that you earn your mood, you earn your health. And that's a big change. And this is actually the 6th E from my talk from last year. So we had 5 E's, I'm going to go 6, empowerment. And again, that's a conversation we'll have a bit more about. But to start off, one of the tenets of CBT is you earn your mood. The other piece is gratitude, bringing gratitude to everything that we do. And as said, here tonight, I mean, I'm grateful for all what you do. I mean, doing public office and the things that you do, you know, is a sacrifice. And I really appreciate and am grateful for what you're doing for our city. Hopefully we can come together and do some even better things. So gratitude is a great way to remember we do have a healthcare system and we do have safety in our city. And those are important things to always remember, but we do need to go forward because there is some dark times ahead. We're going to go Matrix on you. Who's seen the Matrix? The red pill, blue pill? Maybe you have to do that for homework. Again, back to I'm going to give counsel. You get to make a choice tonight. The red pill. basically tells you about the sometimes painful truth of reality, and the blue pill, remaining in blissful ignorance or illusion. And around climate change, that's a great example of what's going on in the world. And I'm going to ask you, do you want the red pill or the blue pill? I do the same thing in my office when I help patients. I will sometimes say, do you want the bitter pill, which is actually the truth? It's not going to taste good or feel good, but it's going to make you healthier and happier. Or we can just do the sugar pill. It'll make you feel good really shortly, but it's not going to do any change. So I guess that's my question to you all. What do you guys want? Because I've prepared 2 talks. I've got a blue pill talk and a red pill talk. So please, we got red right there. Do we have a red? Are we a courageous group? Even you guys? We got a contingent. I just want to thank for some of the slides. We have Laura Loudon from the Division of Family Practice helping me with some of these slides ahead. So we're going red? Okay, so blue pill, blue pill, blue pill, blue pill. Well, kind of blue pill, but we'll give you a better blue pill, or red pill. Blue pill, blue pill, blue pill. Okay, this is a blue pill, but I want to show you how blue pill and red pill can be quite different if you make a scientific, or take a scientific aim. So here is what's going to happen in terms of population. Everybody's very happy in this talk, or in this picture. Population's going to increase from our 0 to 19-year-olds 13%. Our 45s to 64s are up 9%, and guess what? Our 75 plus are up over 125%. It's a nice monograph. But let's go science now and show you what a graph looks like. The purple graph is that greater than 75 graph, and that sort of wows me. And again, this is from 2016. We have another slide from 2018, but I like this slide because it shows a few things. It shows that we in Nanaimo are older than the rest of the province. It also shows the green graph, which I find quite fascinating because I'm in the green graph. We've got a few green graphs out there. It's going to go down. And if you have a tax structure, I don't know, and again, I know it's municipal taxing is different, but that, and is that green, am I going to leave Nanaimo? I don't know what's going on, but that green graph is going down. So it's an interesting point to be made of where we're going in the next few years. So again, 2019, I'm going to show you some of the effects of the graph in the community. 340. We have 340 beds at NRGH. Okay, when I was here back in 2015, we had 306 beds. Now, we didn't get a new building, but we've been able to make more room. This is an interesting graph of what it's been like at NRGH over the last number of years. In the last 2 years, we've pretty much been May, I'll say May 18, 2018, last year and a half, we've been over census. Every day, there are more patients than beds in the hospital, okay? From yesterday, we had 105, I think, % in the hospital. So it just gives you a bit of a flavor of what's going on in the community. Going to shift into mental health and substance use, which is another big part in the community. Addiction, anxiety, depression, these are all on the increase. I'm also going to go on record to say that we do have a mental health crisis. We also, by the way, it's also called MHSU. And in Nanaimo, we have a crisis in terms of our specialist colleagues, our psychiatrists. There are over 1,000 patients waiting to see a psychiatric specialist in Nanaimo. We lost 4 psychiatrists in the last year and a bit. Good news, we've had 1 new one join on in the last week and a bit, so positive in some of the dark, but at the same token, we have some real issues. This slide is always humbling for me. I always like this. It brings me back and sort of says, okay, what about healthcare? I mean, I'm a physician, but I'm not the end game in town. 25% of health, what makes Canadians sick? Your healthcare, okay? But having said that, in terms of what city and municipal do, whether it's income, early childhood development, disability, education, social exclusion, social safety net, gender, employment, working conditions, race, trauma, safe and nutritious food, housing and homelessness, know a lot about that, and community belongingness. And that is, I think, a track that we will talk about, because I am a solution-focused doctor. Even though I'm here giving you some dark, we've got some good stuff too. But this also just humbles me to know that as a healthcare professional, I'm not the only game in town, okay? Let's talk child poverty. You probably know this already, but 25% of our 0 to 5 are living in poverty. Don't have to say more than that. It's just that it's something that we as a community need to address and look at a bit more aggressively. This is an interesting map of Nanaimo. I mean, I think everybody knows there's a sort of a north-south socioeconomic gradient. But you can see full well, I'm going to show you a graph in a second of what's happening in community family practice. But the south end of Nanaimo is the most vulnerable and has the greatest need. Let's talk about family physicians. So this is a map of Nanaimo April 2018, okay? So you can see, I mean, Nanaimo's a funny town. We talk about transportation and bike lanes and even rapid transit, because transportation is something that I see as a healthcare issue. But anyways, this is 2018 April. Thank you, Laura, for helping with this map. But in that time, we've lost 6 family physician, or the closing of 6 family physician offices. One is closing and moving north, a little arrow up in North Nanaimo, which is positive. Those patients aren't losing a physician, but overall, things are not looking good. And now if we look down into the south, we have 2 areas of access for primary care. Okay. Let's go positive. Okay, that's it. He's our light. Does anybody know who this family physician is? Anybody? Steve Bierman, that's right. Steve Bierman, he's meeting the Queen for the 4th time. So anybody that's meeting the Queen for the 4th time must know something. He's actually world renowned in terms of drowning and prevention. The reason why I'm bringing up Steve is that he's my partner and colleague at Anchor, but he's also the cause of some of this stuff that's going on. But he's also the cure, so that's why I'm paying homage to him. So the cause is he is retiring next year. So his practice at the end of this year will be looking for a doc. We're hopeful to replace him. At my clinic, we've been very lucky. We have a lot of young docs in the crowd there. But there is some real concerns. Now, Dr. Bierman had a bit of a vision, and the cool thing is that in 2007, I didn't think he'd be able to do it, pull it off. In 2007, he brought the UBC family practice residency to Nanaimo. And that has been a real positive change in terms of our young doctors. We actually have 2 young doctors from that program in the audience today. So to understand that over the years, since 2007, we've graduated over 80 docs, and 35 have actually remained in Nanaimo. So Nanaimo's doing something right. So there's always talk in the press about a family physician shortage. We don't have a family physician shortage in Nanaimo. Actually, it's a resource allocation issue. We can talk more about that maybe in episode 3 or even in questions. Here is Nanaimo, and thank you, Laura, for the data, in the sense that here we are, we have 88 family physicians in the community right now. We had just back to last year 92 in community. So some have left because of retirement, some have left because of job-related issues or other things. The rest, the interesting, I'll put to the green, there are 32 locum family physician docs in the community. That's something to be said. And I also want to say to you that Comox north of the island don't have family physician shortage, okay? It's the island. I said Nanaimo is popular. We have the mountain, we have the ocean in terms of sort of surfing. This is a good problem to have. If you're somewhere in Saskatchewan and back east, you see a different story. So this is back to Dr. Bierman. He had an idea way back in 2016, and he sort of partnered with myself and Dr. Jessica Aute, and we partnered with our Division of Family Practice and had some really good understanding of this innovative idea of how to restructure and innovate family medicine. That was 2017, because we knew the storm was coming. At this point in time, Primary Care Plus still lays in the file. But just to let you know about relational care, and I talked to you about this, Relationships Heal. Relational continuity when it comes to family medicine, an ongoing trusting therapeutic relationship between a patient and a primary care physician and their team, where the patient sees this primary care physician the majority of the time, results in improved health outcomes, decreased mortality, better quality of care, reduced healthcare costs, increased patient and provider satisfaction, fewer emergency room visits, and hospital admissions. Something to think about. Last but not least, this is some of the inspiration from Dr. Bierman, and I want to now start going into solutions because we're solution focused. We started a Nanaimo family physician house call service. So we're now actually going out to patients in community who can't get to the doctor or who are sort of ill enough that they can't get unless they're going to get up to through the emergency. And we're caring for people in their homes. And I said we have some of the young grads from our program there helping us out. Want to get back to mental health and substance use. As I said, I'm not just all dark. I want to give you some of the things that are happening, and I want to congratulate the city for some of the things that you have done. The Food for You program, which you started back, Food is Medicine, which you were helping and then helped get going with the Nanaimo Loaves and Fishes. That is so cool, that type of work that has started and needs to definitely keep growing. You have sponsored the Nanaimo Walk with the Doc program. We're always there, always. I invite anyone in the room. The second Saturday down at Moffio Sutton, where we're walking at 10 o'clock and talking health and other things. And that's a city thing that's gone on for about 5 years now, so thank you. So exercise is medicine. Relationships heal. You, in sort of partnership, helped us start this teen stress anxiety group. And those balls, my class made those last week for you. And now they're not called stress balls, we call them CBT balls. Your job might be a little stressful, but it's at least something that one of those kids has sort of put that back to you, because as I said, it's a free program, so thank you. And then there's some really cool innovation with the Youth Wellness Center, and I know this gentleman's in the room with a bit of a vision on how to partner healthcare. At the Aquatic Center, there's been the start of the Youth Wellness Center, or a youth hub, and that's for kids or young people 25 and under for access to healthcare, be it mental health or other things. So I said, these are really cool things that the city has done. We need to do more, of course, because of the crisis. I've brought a whole bunch of these MHSU health pads, which I will share with you at the end, of how to access mental health services after hours or during hours. We now have CBT groups programs. The division has brought that up from Victoria, and we actually have one of the facilitators in the audience today, Dr. Bell. We have a couple apps that I find useful. I'll just say MindShift app as well as the Booster Buddy app. Again, small changes, but can make small steps to make bigger changes. Last but not least, I want to just talk about the Urgent Primary Care Center, which has opened in Nanaimo. You may not know this, but a year ago, we had an offering from our ministry to open an urgent primary care center. It was a tough decision because they wanted us to do it, i.e. the ministry, within like 4 months. The nice thing is, understanding bureaucracy and politics, we were able to come together as a community, and I'll just say the GP Specialist Think Tank and community partners, which included council members, Sinemu, Patient Voice, business, I'm missing somebody, I'm sure. Having said that, come together to make a decision to have it at the Medical Arts Clinic. It's opened, and it is now 7 days a week, and it's an integrated team of doctors, nurses, social workers, pharmacists, and mental health counselors. Again, something that Nanaimo can be proud of, because we can come together and make some pretty cool things happen if we're given the opportunity. Just going to finish off on going to Africa, because I said I was going to go around the world in terms of some of the solutions. Africa, this is something called the Friendship Bench. And in Africa, or in Zimbabwe, they had, I get this right, 12 million people, 2 psychiatrists. They had a mental health crisis. Well, we all know that sometimes psychiatry is also human connection, community belongingness. So somebody got a wonderful idea about starting these things called friendship benches. And they trained retired grandmas in terms of solution-focused therapy. And the cool thing is, this has made a radical difference. There's TED Talks and other research articles done on that. So taking Africa sort of to the next degree, we went down to Victoria and bought a retired bench from the, what was it called? The Victoria Lawn Club. And it's an 8-foot cedar bench, and we painted it orange, and we put it up at anchor. So I said, it's just a first step, but it's something that we have to start thinking outside of the box with some of these healthcare issues. Want to end off with looking not so far, but across the water to Gabriola. They also had a family physician shortage there. So what did they do? The community came together, built a clinic. They came under budget and on time. Of the class of 2019, 7 of the 9 graduates want to stay in Nanaimo. What I'm just going to end off with, if you build it, and I said I'm not asking the city to build it for us, I'm just asking the city to help be with us in something like this, that if they build it, the family physicians will come. On that note, am I behind or ahead of schedule? Or?
Just about right on
Oh,
time.
perfect. Okay. So I'm going to, because of our journey through healthcare and bureaucracy, I've actually asked my colleague, Dr. Jenny Bell, to speak on behalf of the GP specialist think tank.
But I'm really quick, I'm just a minute or two. So I'm here on behalf of the Nanaimo think tank, which represents the medical community. So in our think tank, we have representatives from every family practice clinic in Nanaimo, as well as a psychiatrist, a pediatrician, and an internist. So the idea was so that we could come together and identify what we see as the medical needs in Nanaimo so that the funding and resources can be allocated appropriately to what the actual needs in the city are. And so we have 3 main aims. One is to revitalize and encourage the revitalization of family practice in Nanaimo. And then the second one would be for attachment so that every person in Nanaimo has access to a family doctor. And the third is prevention of physician burnout. So it's just to let you know that we're here and happy to interact.
Thank you. I believe we have at least one question.